Welcome back to the program, Dr. Mielke.
Thank you.
You know, we just tossed that term out there, optimal health. Certainly, if you're not having optimal health, you know when you're sick. But how do you know when you're really functioning on all cylinders?
Well, people feel good. I mean, it's that simple. They have energy, their brain is working well, they can remember things, they can make it through the day without being tired. They have
or 2 pots of coffee.
Yeah, that's right. It doesn't take stimulants and things for them to be able to just function well and feel good.
Doctor, if you were to take a survey across the population, I think pretty much everybody would tell you, you know what, suffering from that. Is it because we're so overloaded with stress and, you know, we're not sleeping well and not getting enough nutrients?
It's a combination.
Like an epidemic.
Yeah, it's a combination of all of those things. You know, lack of sleep is epidemic. People stay up way too late. Studies show that everybody really should be asleep by 10. Believe it or not, yeah.
Everybody?
Yeah, because there are certain circadian rhythms in our body that work better if we get that much sleep. But, you know, before midnight, you need to have a couple hours before midnight, actually. So, like 10 to 6 or 10 to 7 would be a good number of hours of sleep, and it needs to be continuous sleep. A lot of people wake up several times during the night, and studies have shown that sleep is poor quality sleep. You won't wake feeling rested.
All right. Well, okay, there's a lot to cover. How do you begin? I mean, to change your lifestyle.
Well, I think diet and nutrition is an important place to start, and we know that the foods that most Americans eat are very low in quality. You know, fast food, junk food, trans fat, high fructose corn syrup, MSG. Our foods are loaded with these things, and they're toxic. And so we really need to avoid those things and eat whole grains and organic fruits and vegetables and all those things everybody talks about.
We hear this, but it's easier said than done.
Yes, it is.
You know, we're, again, on the run. You need to grab some fast food to get through the day.
I know. But even supplements, okay, since it is so hard to eat everything that you need in your daily diet, I think the importance of taking good nutritional supplements cannot be overstated. I think like vitamin D, for example, is a very important one. Most of us are deficient in vitamin D. Studies have shown that almost all Americans are deficient in vitamin D.
Okay, vitamin D. Let's talk about that just for a minute, because isn't that something you get from sunshine? And
yes.
So are you saying that, or are we deficient because I read a story about this, that moms thinking they're doing their kids good, they're slathering them with sunscreen, and that prohibits the vitamin D from...
That's right. Well, we don't want to get skin cancer, and burning our skin, of course, is bad. But when we put on sunscreen, we are preventing us from making vitamin D. And in the winter, there's not enough sun to make vitamin D in the first place. And so it's not a coincidence, for example, that colds and flus are much more common in the winter than they are in the summer. And it's because our vitamin D levels are lower in the winter than they are in the summer. Vitamin D is very, very important for enhancing the immune system. So one of the most important things you can do in the winter to prevent flu, for example, is not necessarily get that flu shot, but enhance your vitamin D level.
So vitamin D primarily responsible for
preventing viral infections. Vitamin D prevents almost every kind of cancer. It also prevents almost every kind of autoimmune disorder. So things like MS and lupus that are very common in women, for example. Vitamin D deficiency is partly to blame for that.
Okay, but what's a deficiency? You see the RDA says, what, 200?
The RDA is like 200 units for a child and 400 for an adult. And the amount that most integrative health doctors recommend, including myself, is for an adult, like 5,000 units a day, even 10,000 for some people, and for children between 2,000 and 5,000 units a day, which is way above the RDA.